thanks for joining us, Julian. And I know it's going to be a great webinar as always that you deliver. So thank you very much.
Thank you, Jim, and welcome everyone who's joining us to today's webinar. I've been working with VITA for many, many years, both from the chairside CAD/CAM products to the laboratory products. So today we want to talk about a new alternative that we have with the development of digital technologies, which is the pressable ceramics for highly aesthetics restorations with VITA Ambria in combination with digital workflow, what we have titled the print press workflow. I think this is a great alternative to many with 3D printing technology, but want to have a long-term restoration and a high-end aesthetic restoration as well. So what I've been doing for the last 9 years here at UPenn is working with my mentor, Professor Marcus Blatz, on doing research and clinical implementation of different materials and different workflows, as Jim was mentioning. And I would like to show some of these work that we have been doing and just summarize what we believe are the clinical aspects that will lead us to success with aesthetic anterior ceramic restorations. This is a great article by Dr. Rene from 2015 actually, but these are the things that don't change in modern dentistry, right? We know and we give the importance to the quality of the tooth preparations, whether it's partial coverage or full coverage restoration. Still, you will see that the quality of milled restorations depends totally on the quality of the tooth preparation. And many of you here are probably dental technicians, owners of a lab, and you receive many different types of preps, right? And you know that you can mill a restoration in a good prep, but you also know that if you mill a restoration in an ugly or poor preparation, you might not have that marginal adaptation that you desire. And that's where we know that pressable ceramics give us a very good marginal adaptation. We know that with pressing, we can pretty much compensate, block out undercuts and things like that, all the magic that we do on the side to make sure we obtain the best marginal adaptation. So that's why I like to be always focused on both dental workflows, digital CAD/CAM workflows for the dentist, but also linked with the lab as well to kind of understand the best of both worlds and understand what it's needed in order to be successful. The other aspect that we've seen after multiple studies and thousands of specimens that we have checked and reviewed, whether it's scans or printed or milled components, is the importance of the instruments that we use, right? We need to have nowadays instruments that are with a finer grit that let us have preparations that are very smooth and preps that will give us a surface that won't have sharp internal angles. That way the machines won't overmill in the intaglio, or the lab technician won't have to block out those areas to have a better marginal adaptation. So we developed this kit with Brasler a few years ago. I think it's incredible for anterior crowns, posterior crowns, FDPs, and every type of partial coverage restorations like inlays, onlays, vonlays, overlays, etc. What we think that is more important as well, but many times is neglected, is how to manage the soft tissues in the aesthetic zone. We need to have small, round instruments to pack the cord and be very specific with the thickness of the cord and the time that the cord spends in the sulcus to avoid recessions or avoid bad quality digital impressions. And we will talk through that with clinical cases this afternoon. Not only the retraction, but also the protection, because sometimes I want to get a perfect margin. I see the irregularity on the microscope, but I need an instrument. This is also from Brasler. We can protect the tissue. It's like a shield, so I can smooth that margin. This is from the partial extraction therapy kit. You can find it in the Brasler website as well. So better instruments, smaller instruments with a finer grit, with the use of magnification, then we can kind of match what we do in the clinic with what we can do in the dental lab, magnifying our file in the software hundreds of times, because we know that if we have a fine instrument, we can have a nice smooth margin, and everything that we do, whether it's milled or it's pressed, will have a much better chance of getting the marginal adaptation that we desire. So that was kind of an introduction for today. And now we're going to start moving into ceramic materials. And today, I don't want to talk about all the three families of materials as we have classified them in this publication a few years ago, but just as a quick summary, we have the resin matrix ceramics, which are all the materials that have certain percent of resin. The materials that we can print nowadays in 2024 will be in this aspect, in this group on the left, also with the resin blocks and the hybrid ceramics like VITA and Amic. Why? Because they have resin, they cannot go to a furnace for finishing, staining, and glazing, etc. You need only a light cured finishing system. So that's what we have on resin matrix ceramics at the moment. On silicate ceramics, we're going to focus today on this group, mainly on the newer versions of silicate ceramics. And I'm planning a series of multiple webinars with VITA North America this year, where we will talk also about the different groups that we're not talking today, as zirconium oxide, as we've spent many years researching and working on implementation of zirconia as well. So let's go into silicate ceramics a little bit more in depth. And lithium disilicate, without a question, has been a very successful material for many, many years. It's a strong material that can be bonded. On the downside, it's a material that it's monochromatic, right? We don't have the block with a multi-chromatic effect. And then new generations came, like zirconia reinforced silicate ceramics. If you have a milling machine, you can use these materials that are, let's say, stronger than the traditional feldspathic ceramics. But now with the printing technologies and the combined workflows, we can also get the benefits of these materials. So this is just kind of a history where we come, right? We were using zirconia reinforced materials as a block. This is one example, VITA Suprinity. And let's say these type of cases where we have central incisors, patients with a high aesthetic demands, we can make our scans here, and then we can communicate the shade. Here I had the possibility to send this to my good friend Telmo Santos, an excellent dental technician and ceramist, and then he starts designing and milling the restoration. So with the milled Suprinity, we have the possibility of applying stain and glaze, and this is what I tell the clinicians. If you want to improve your game on this, train with the dental technicians. Take hands-on courses so you can take your stain and glaze level to the next real level of aesthetic results. So here we need to crystallize this and then do the staining and glazing. You could use any of the VITA furnaces, or if you are a person with the CEREC system, of course you can do this as well with the CEREC Speedfire. And you can see here a very nice and natural aesthetic outcome with a milled type of material with the traditional CAD/CAM workflow. Okay, so now let's start moving into more options. This case, if anyone wants to review it a little bit more, please shoot me a message on my Instagram account. I'll be happy to share you the PDF. This was already published a few years ago. This was the first case I did with Telmo Santos, and I want to show you some of the work we've been doing together. So after that, we started to work on more complicated cases, same as you guys have every day, right? And we came up with this technique called the Reshape concept, because sometimes we have periodontal complications and we have very severely discolored teeth that maybe the traditional chairside workflow with CAD/CAM for a dentist is very, very difficult to be successful with this level of cases. And this is one clear example, right? Patient with sequela of periodontal disease, it has been treated, teeth are healthy, mobility has diminished, but now we need to restore these. And many times patients don't want to go through any surgical treatment. So with the restorative weapons and tools that we have, we need to try to find a way to solve this. I emphasize always on the diagnostics part. We shouldn't forget that we need to provide enough time to review what's exactly happening. Right here, as I said, there's a sequela, ferio, even though it has been controlled. The teeth are also very discolored due to fluorosis and patient disagreeing on grafting and ortho and more complex treatment options. Sometimes we gotta also remember that more is less and less is more when we are treatment planning. So as every case we treated the aesthetic zone, we start with photographic documentation of the patient face with could be done with a smartphone at a high smile line. You want to have this image as centered as possible. And then you add your STL files of your pre-op scans. And then we can start discussing about space distribution. Aesthetic dentistry for me, as I always tell it, it's about space distribution. If you like to do this in your clinic as a clinician, that's perfect. If not, just take a good portrait in a high smile, a good STL pre-op scans, and send these to your lab technician who will work on this digital wax-up and then will send you the file. So in your clinic, you can print this model and just make a putty matrix, and then you're ready to make your mock-up. You can make your preparations as you see here, and you can also work on your provisionals. So what I like to do is create this design that as a clinician I know where the tissue level was, where I needed a double core technique in certain areas. But in general, I always use a 000 chord first, followed by a second chord, which is 00, which I will remove, dry, and make the intraoral scan. I always scan with the 000 chord in position. And here I understand that the contact point areas are at 5 millimeters from the crestal bone. I check these with my digital x-rays. I can also make a CBCT and correlate that when the technician is doing the digital wax-up, so we know exactly how can we anticipate the presence of papilla, or how the technician needs to modify the length of the contact points in order to have tissue closure. The difficulty here sometimes is that we can have a very nice set of provisionals, but then when the final restorations are made, the morphology of those restorations it's slightly different. The emergence profile is not the same, and then after a few weeks after cementation, you might see black triangles or cervical margins that have receded slightly because the final restorations were a little bit over contoured. So we came up with this technique, which is the Reshape concept. Basically, we use the information of the provisionals and export that into the exocad software where Telmo will be designing the final restorations. But what I try to tell him is that I don't want that subgingival portion of the restorations to be modified, to be changed. So it's pretty much like a biocopy, but actually of the subgingival part of the restoration. And what is he's doing here? He's improving the initial design with a new library from exocad, but maintaining the subgingival contours as you see here on the image on the right side. This is very important, so when you try in your final ceramic restorations, you don't have any surprises, and you can see here how nice the soft tissues can be improved without any surgeries, without any grafting, just by modification of the emergence profile of these restorations. So this was done as well with printable workflow in combination with an injectable pressable technique that I will show in more detail. So what do we have as a material to combine the 3D printing and the pressing techniques? We have VITA Ambria. What is VITA Ambria? It's a zirconia reinforced lithium disilicate glass ceramic, but in a press or pressable system. We can use it for veneers, inlays, onlays, and full coverage restorations, anterior and posterior crowns, and for 3-unit FDPs up to the second premolars. I wouldn't use this for molar bridges. This can be used in two different levels of translucency, the T and the HT, and it comes in two different sizes, the pellet, in small and large, with its own muffle system and investment, so the lab technician can have an entire system to go ahead and do this. So this is a screenshot I took from the material PDF document, and this tells you exactly the different methods that you can use the material and the different levels of translucencies. My suggestion, whenever you have endo-treated teeth, metallic posts, or discolor natural teeth, I would like to always use the translucent and avoid the HT. I also would like to make sure that I have a consistent thickness of the material, because also if I have a very thin veneer next to a thicker crown, the changes of the final aesthetic outcome with high translucent materials could be evident. So these are things that are important to diagnose before we do the preps, before we select the final material. As I said, you can use it in the posterior region, we can use it in the anterior as a monolithic material, stained and glazed, or with a mini cutback, as you will see here, and layered ceramic for a higher aesthetic outcome. The ceramic system, VITA Lumex AC, is ideal based on the temperatures and contraction effect of the material when fired. So you can use this in conjunction with the Ambria products. So now let's focus into the CAD press technique. So here I want to show a little bit of both the clinical and the laboratory sequence that we use. This is the initial situation of my patient. You can see severe non-carious lesions, not only in the cervical aspect, but those ones are extended to the middle portion of the tooth, the thinning of the incisal edges as well. And this is a case that we need to understand pretty well the occlusion, the posterior support to replace these lesions. The first thing I do at the beginning of the appointment is always do the shade selection and understand that there's a limit on the numbers of colors that I can improve if I'm using very thin restorations. If I have 0.3 to 0.5 thickness veneer, if I have a feldspathic ceramic material, it's going to be too translucent, and I am not going to be able to get maybe a B1 if that's what I'm looking for. With these, let's say, slightly less translucent materials, with these type of discolored dentitions, they help you mask them with a less invasive preparation design. So this is a great advantage that I like about this family of zirconia reinforced silicate ceramic materials. So these are our diagnostic digital impressions, and then from this we start doing a digital wax up. This wax up, I do the design here, and then I'm going to 3D print this model and make some putty matrices for my provisionals and also for my prep guide, so I'm sure that I'm having homogeneous space. But also with the burr block that we have, as I showed you at the beginning, we have a burr that is only 0.3 millimeters in diameter, so it won't remove unnecessary enamel. We want to make sure that we have, in these cases that are compromised, at least 60% of the tooth surface on enamel. So we do the printing, the putty matrices as you see here, and then I go do the preps and the final impressions. If you see here, you can still see some of the areas of that exposed dentin. I'm basically providing 0.3 to 0.5 homogeneous space from my digital wax up. In some areas, this is an additive case only, and in some areas, I just need to do minor modifications, minor preps to provide enough space for the ceramist. So what Telmo does, he receives my final impressions, and then he makes a design. He designs these, and now what he can do, he can 3D print this on a resin, and then he can press these printed units with the VITA Ambria. Before this workflow, we were using wax material that was milled, right? But for that, also you needed to have the milling capabilities. Here, if you have a 3D printer and if you have a pressable system for ceramics, you can 3D print your designs. You can then place them on your pressing unit, and with the VITA Ambria material, you can obtain a nice restoration. So it's nice to see how we are adapting the new technologies that we have, but in our perception, the quality of the final restoration, the aesthetics and longevity is more important than the techniques that we have. So here are some details for you guys in the lab, right, on how to screw these properly. We always want to make sure that we have a homogeneous thickness of investment with a minimum of 10 millimeters, as you see here. And if we're using a 3-unit bridge, we want to make sure that we have no more than 16 millimeters, so we have enough material to have a nice final result, right? The angulation is important as well. I don't want to get too much into these details, as maybe some of you here don't do the lab, but this is important to consider when you are doing the pressing. What is nice now is that we can design the sprues in the software now with an ideal angulation, and then it's less work to place this in the base and do the investment. So then we use the VITA Ambria translucent version of the material, and then we can have a great final restoration. This is a very affordable workflow because you can see here that with one pellet we are actually making 5 restorations. So compared to milling and the cost per unit based on the cost of the block, this is also a great advantage that the print press workflow offers. So this is also something important to consider. Here we have 2 different sets. We were testing the material. We were working on just milled and stain and glazed, or also using the Lumex ceramic for a more customized option as well. So we have the freedom depending on what we want. If it's a patient with very high aesthetic demands, high smile, maybe we can do the micro layering. Or if it's a more straightforward case, maybe a patient with a lower line, we can just do monolithic, pressable, and then apply the stain and glaze. I always like to use a clear trying paste. What I'm showing here, it's the clear trying paste from Panavia V5. That's from Curare Noritake. And you can see the very nice natural aesthetics that we can achieve. This case that I'm showing here, it's the one that has been micro layered with a Lumex ceramic. Okay, so now that I have the approval from the patient, I will remove the restorations. I will make sure that I clean them perfectly in the ultrasonic, and then I go ahead and do the etching. Silicate ceramics have more crystals and less glass compared to feldspathic ceramics, so here we need to etch for a shorter period of time. Here I'm etching with hydrofluoric acid for 20 seconds only. Once we do the etching, we need to also clean very well the internal surface of that restoration. When we are doing pressable ceramics, there's a clear benefit of cleaning the surface after it has been etched. I didn't found a clear benefit when the restorations are milled, but when they are pressed, this application of phosphoric acid or alcohol ultrasonic bath is important to remove any debris of those salts remnants inside the etched surface of your ceramic. Once you do this, then you have a nice rough surface that is clean. So all those irregular surfaces that we created are exposed and ready to receive your silane coupling agent. We use the Clearfield Ceramic Primer Plus as it can be used for any type of material. whether it's a feldspathic, a silicate ceramic, a zirconia, or a printed resin. So with this one bottle system, I don't need to worry about having multiple types of silanes. Okay, so we etch the ambria for 20 seconds, we clean it very well, and then we apply the silane coupling agent. This is giving me the possibility of having a micromechanical retention and a chemical retention as well through the bonding. Then I go with the final cement. This is the same color as the try-in, but now the final real cement. I apply it in the inside part of the veneer, and then I'm going to start the adhesive cementation process. It is very important that we fill completely the intaglio part of the veneer, so when we insert it all the way to its final position, we see a flow of excess all around 360 degrees of that margin. The excess will tell me that the restoration is properly sealed and that is not going to be catching plaque and less chance of getting secondary decay. So here you can see a very nice aesthetic outcome with the print press technique and a small micro layering with the Lumix ceramics. As I said, these cases that patients want something very natural, that want to maintain the characteristics of their opposing teeth or how their teeth looked, when we need to highlight those blue areas, those white areas in the incisal, even some orange on the inside, the micro layering technique with the VITA Lumix will give you that high-end restoration. When it's a more straightforward case or a full mouth rehabilitation where we're doing all the restorations, then I wouldn't complicate it. I will just go with a monolithic solution, and with the VITA Accent Plus, then we can do the staining and glazing on the external surface. So the nice thing about this workflow is that it gives us flexibility depending case by case what we want to do. And then for us, no matter what ceramic material we're using, we need to protect them, right? So immediately after cementation, we're going to make a scan of the patient, and then we design a night guard and then print this with a night guard material, making sure that we have 3 millimeters in the distal part. Now, let me show you another case that we finished more recently between Telmo Santos doing the lab and myself doing the clinical work with our great students here at Penn Dental Medicine. And basically, what we're seeing here is a very challenging initial situation. You can see that there's some decay. There's already a pre-existing crown on tooth number 7 with some inflammation of the soft tissue. So we need to treatment plan this very carefully. I might be ending with a few veneers and a crown, so I don't want to use the most translucent material out there because, as I said, just the differences on the thickness of the restorations could have a slight difference on the final color of the restoration. So here we like to use this translucent version of the VITA Ambria material, not the HD. When would I use the HD? Whenever I'm doing, let's say, 6 veneers from 6 to 11, but the color of the abutment teeth is very natural, very nice, and I'm not going to have differences between one color and of one abutment and the others, where I'm not going to have big differences on the thickness of the final restorations, then the HD would make sense. Okay, so here we start talking with the patient, of course, about the changes on diet, about the changes on hygiene, because if these are not understood, these final restorations we make are not going to be successful. And at this point, it's not about the technology, it's about understanding the pathology that we have here, right? And the factors that are affecting this patient to get into this situation. So we take a few weeks to follow up with the patient to make the patient understand and make sure that the patient is going to change on their habits and the hygiene protocols before we get into the therapy. Okay, so after documenting this and hygiene therapy as well, we take the images, as I said, always a portrait and a high smile, the intraoral scans, and with this we create our initial digital smile design. We print that, we make the putty matrices as I showed in the previous cases, and then we start preparing these teeth. When I was trained as a prosthodontist, maybe I was doing much more full coverage restorations. Nowadays, what I try to do is to maintain the healthy portion of the tooth as much as possible. But in the facial aspect, I want to make sure that I make a preparation that gives the dental technician, the ceramist, or if it's me doing the design in a type of CEREC system, enough space. We need to prep to create space for the final ceramic material. Okay, so here the good news is that we have a good posterior support, a class 1 occlusion, and then what we need to do is just maintain this vertical dimension in maximal intercuspal position. That's pretty straightforward for this case, as I'm not altering the vertical dimension or the MIP. So once I have studied that and analyzed that, I'm going to get started with the preparations, creating a homogeneous space as I mentioned. So here we work at distance. Telmo is now residing in Miami. I'm here in Philadelphia. So he never gets to see the patient. I do the preparations, I send him the files, but it is important that we are always taking a few time to connect on a Zoom call and review the positions of the margins. Why? Because I'm the clinician making the tooth preparations. I'm the clinician packing the cord, so I know where I might have a risk of a black triangle, where I want the restoration to end in the proximal region to avoid having any surface of the tooth that is discolored showing next to the margin of the ceramic restoration. So even though we're at a distance and we use dental technologies, we use the technologies that we have to connect. It could be 10, 15 minutes on a Zoom call, just reviewing the margins together, just reviewing the initial design. And once the clinical part has been discussed with him, then he can focus on doing his nice work. Here, we're going with a more simple workflow. These are print press with the stain and glaze technique only. With the VITA Accent Plus, you can see how he uses the light blue and the white, a little bit of the more saturated stains in the cervical region, just to have a nicer final outcome. So the last case, it was with a micro veneering with a Lumex ceramic. This one, as we have more restorations, we go with stain and glaze technique. So that's what I was mentioning earlier. These workflows gives me that nice flexibility depending the case, depending on the experience level of the technician, what you feel more comfortable with. But with stain and glaze right now, as you can see on the veneer in the right, you can obtain a really nice and aesthetic restoration, which is monolithic and which in case something happens, you can always produce it again, right? Because you haven't layered manually. So those are some of the advantages as well, and it might take you less time for production of each of these restorations. So nowadays, what I'm using for the cementation of the veneers is not the Panavia V5, but the new Panavia called Veneer LC. The nice thing is that it's a light curing resin cement that gives me, my students, more time to insert the veneer before the material starts to set. So I'm going to make sure that I'm fully seating the restoration and that I can remove as much excess as possible so I don't hurt the soft tissues during the removal of the resin cement. We have the different colors, but a great color that it's new is called soft white. It gives you a little nicer, brighter look without becoming too opaque or too white as some other resin cement systems for veneers used to give us, which I don't really like because the case loses some naturality. If the clear one is looking great, that would be kind of my first option. But if you want to always give a highlight on the value, and the soft white be 0.5 is something really nice for this type of anterior cases. And it is a light curing cement. It comes in a let's say one syringe, like a flowable. It's not a mix of a base and a catalyst, so also it lasts longer because there's not a big mixing tip. So I do like that as well. And you can see here, this is just a few days after cementation. Really nice outcome of the ceramic restorations with the print press technique, and only a stain and glaze for the finalization. What I say, no matter how good the ceramist is, if in the clinical side we don't take care of the soft tissues, if we don't understand how to manage the gums, how to retract them, how to make those digital impressions with a lot of detail and provisionalize in a way that the patient can maintain healthy tissues during the week or 2 or 3 weeks that the lab technician is needing to send you the final restorations, those nice restorations, those nice ceramics won't give you a successful final outcome. So it's a clear teamwork, attention to detail from both the clinician side and the dental technician with a clear communication. If you're having issues on shade selection, I would suggest into reviewing the content about the VITA Easy Shade, because with the VITA Easy Shade we have the app called Mobile Assist, and with this you can combine your intraoral images of shade selection with the information that the Easy Shade spectrophotometer system gives you. And I think that these will always be beneficial with that communication between you, the clinician, and your lab technician, or the other way around. So here, I really like to see that nice warmth that the VITA Ambria material has, and with a minor staining and glazing, mostly in the incisal edge, you can have a restoration that looks very natural. And as I said here, we have one crown on number 7. The rest are laminate veneers, but this is the translucent one, which gives you that little more of opacity. So whenever you have combination cases, some veneers, some crowns, different thicknesses, you don't end up with a different color. And these are important aspects to decide if I need the high translucency or the translucent version only. On this group of materials, I personally prefer the T instead of the HT. You can see here at a follow-up appointment, the tissues look even better now. These might be probably 3 weeks after cementation. You can see that the position of the antagonists are not ideal, but when we start, working and improving the oral condition, the aesthetics, the patient starts to get motivated, and now she wants to move into some orthodontic treatment to fine tune the position of the lower teeth and have a final, more ideal condition on her lower incisors, as this malposition difficults the hygiene of the lower teeth. So it is important not now in 2024 focus only on the digital technologies, about the model of the printer that I have and the model of the milling machine that I have, or my scanner, or my milling device, but making sure that we use the newer technologies for a better diagnosis. That's what it's going to actually provide us with a long-term clinical success, because as clinicians, we don't like to do remakes, right? None of our patients, whether you're in the clinic or in the lab or doing both, likes to have or spend more time doing remakes. Do failures happen? Yes, they happen, but we want to minimize them as much as we can. We also know that one bad outcome could affect also, as people do a lot of mouth-to-mouth referral, or in the negative side as well. So these are important things to consider. The ceramic, as I said, it's significantly stronger than the traditional feldspathic ceramics. Milled restorations always suffer slightly due to the milling process. Print restorations have always shown after research that they might have a slightly higher flexural strength, even though it's the same material when it's pressed compared to milled. There's no stress as it happens with the milling. So the bonding is always important, but here we have a stronger material and that has different workflows to select depending on what you as a clinician or your dental technician likes. Of course, having the teeth in the ideal position based on the lips, the interpupillary line are always our guidelines to make sure that the teeth are long enough, that have the symmetry in the centrals, slight variations in the laterals, and that when the patient is in a full smile, we do have a nice relation of those incisal edges with the internal curvature of the lower lip. This is a close-up here at rest. You can see a very nice outcome, very natural looking type of restorations obtained with this print press technique with VITA Ambria translucent. And this is the final image of the portrait of the patient. So no matter what material or workflow we are doing, for me, this is one of the most important um, parts of the treatment, and in many, many times neglected by both the clinician and the patient or the staff, right? We gotta get these scans immediately after cementation, and we gotta have this patient come back for the delivery of the night guard. Now we can print them in-house, or you can have them designed by a lab and send you the design and you print them so you don't lose time, or you can have your lab do the whole thing. You just send the initial scans. As I said, we always want to have 3 millimeters of thickness on these occlusal appliances, and make sure that we see the patient at least one more time to check that they are not um, creating any type of pressure in any specific area. So the patient really uses this on a daily basis. So the before and after, no surgeries here, only one crown and 9 veneers with the workflow that we have discussed today. So I would like to start closing with some conclusions, and then hopefully there are some questions that we can interact with Jim and go through them. But what I want to emphasize today, and nothing has changed in these aspects since my early days in dentistry or in the laboratory, pay more attention to details. Whether you like milled, whether you like print or combining printing and pressing, it's all about the details, not only in the lab, but also in the clinic. How you make your putty matrix for your mock-up, how you make your putty matrix and the quality of your provisionals to maintain the soft tissues where they need to be without inflammation. It's all about details. Okay? If you ask me, can I do the same quality when I have only 45 minutes or when I have an hour and a half to prep and provisionalize? I will always do better when I have additional time. Secondly, if you're a clinician doing staining and glazing and milling, we need to work more on our hand skills. Even if you are a very good and experienced dental technician, now maybe you're starting to work with printed materials or combination of printed with pressable materials. We always need to start playing around. And I don't think that we should start playing around with materials in cases with our patients from the first day. I think that we should invest our time working in the understanding on the best techniques and the ways that we treat that material before we move into patient care with that specific material. So VITA North America offers plenty of courses, not only webinars, but hands-on courses for different levels, whether clinicians or technicians. So please, if you have more interest in these, contact Jim, and I'm sure he has um, a lot of options, more now that they're celebrating their 100 years. I've seen how many courses they're putting together. I really believe that webinars are good up to a certain point, but when you combine the knowledge with the practice, lab and clinical, that's where the level of our work really improves significantly. What else? Let's make sure that we use materials for the specific, um, I'm sorry, let's make sure we use instruments for the specific materials. This is an example of a acrylic kit that I use when I'm working with my provisionals to make sure that that surface is smooth, and then the soft tissue is going to react perfectly for that material. If I'm using ceramics, then I need to use a specific polisher system. VITA North America understands this, and they offer different polishing systems for ceramics. They have one for hybrid ceramics. They have one for the silicate ceramics. That would be the one indicated for Ambria as well. And also, if you are going to be using zirconia, we need to have specific polishers for that group. In the upcoming webinars, we're going to be touching both on feldspathic ceramics and zirconia as well. So I'll be showing some of the kits that we use, but this is very important. We always blame the material whether something wrong happens, but most of the time it could be that we are working this with a very coarse instrument, with a very high speed, overheating the material, and then the material is already weaker before going into the patient's mouth. So that's why we make so much emphasis, no matter what brand you like to use, but most of the brands now have different polishing systems for different materials or families. And then the last conclusion that I would like to say is always to try to deliver what makes you proud. I think that nowadays marketing is so strong in the dental industry, right? Not only to the dentist, but now directly to the patient, that all the patients pretty much demand that we give them, teeth in a day, teeth in an hour. And if we go to the ADA guidelines and go through how long should a restoration be in a mouth in function, we agree that 10 years is kind of the target, right? Does it really matters if I deliver the restoration the same day, or if I take maybe an extra 2 or 3 days or an extra week, maybe send it back to the lab to do an improvement of the shade, of the contours, of the texture, or for me as a chairside CAD/CAM user, maybe milling it again in a other level of translucency. Those are things that I do sometimes, and I want to make sure that what I deliver is something that really makes me proud and that going to make the patient very happy and confident, because those are the patients that do really refer. Patients value your effort and they really don't value your rush. So I wanted to finish with this: deliver what makes you proud. And this applies for veneers, for crowns, because when we're working in the aesthetic zone, we have many variables, right? We talked a little bit today about the soft tissue conditions, and we're going to talk in further webinars on the differences of different abutment types, whether it's a tooth-supported restoration or implant-supported restoration, and how we need to understand all the materials to make the best selection. I don't want to give all that responsibility to the lab technician. I want to have a discussion, a communication with the ceramist, what the ceramist feels better working with, what I suggest would be the best material as well, so it works well in both hands. So this is a QR code that I just put there for my Instagram page, dr.julianconejo. If you guys have any questions later, you are doing one of these similar cases, or you want any of the PDFs that I mentioned from our publications, just shoot me a text there, shoot me your email, and I'll be happy to send you the PDF of all these publications we've done. I would like to thank Telmo Santos, great friend and amazing as well, dental technician. He did all the lab work for these cases that I presented today. And I think that that's how I learn working with excellent ceramists as a chairside CAD/CAM dentist as well. So soon you'll be hearing through the VITA North America marketing team of the topics of the other webinars that I'm preparing. But as I said, we're going to focus a lot this year on feldspathic ceramics as well, on veneers and detailed clinical step-by-step protocols. And we're going to be focusing as well on zirconium oxide um, for bigger types of restorations or combination cases, and as well as working with the edentulous patients. So stay tuned for that. And I think Jim is around. So Jim, if there's any questions, I think we have the time to try to answer them. Thank you very much, guys, for your time.
Yeah, thank you, Dr. Conejo. That was an excellent presentation, and appreciate um, all the concepts from clinical to laboratory, which is great. So before we get into some questions that we do have, CE, as I mentioned before, CE will be delivered to you through the registration forms that you did for the webinar. So give us a couple days to process those, and those will be processed through. We did record the webinar. You can visit it again on our VITA North America YouTube channel. If you need to get a hold of a local rep, here's a list of local reps that we might have that can help you out, including our help desk as well. We do have a bunch of different webinars. We'll be adding some more, of course, with Dr. Conejo of various topics, which is really great. We try not to stick to one topic. We got a lot of educational stuff, concepts and things, so we want to make sure that we present as much education as possible in various forms. So please visit us again on a webinar. And then Julian, I'll have to get your new QR code and put it on the slide here. But this is additional information. So if you do need to contact Dr. Conejo for any of his concepts that he's delivered, or you have a question, again, he's open to you emailing him, contacting him, and he'll get back to you as soon as he possibly can. And so we'll go ahead and get some questions going. One we have, Julian, is for pressed posteriors. What kind of material thickness do you try to stick to? I think you're on mute.
Okay, so sorry for that. It was a great question. Let me start again. And it's always that fine line, right? Whenever we're talking about posteriors, what's the thickness that we see that works, that we feel comfortable as well. And it's not only about the manufacturer indication, but also we need to evaluate the structure that we're going to bond to. Because if I have healthy enamel, rim, and dentin, clean dentin, then I'm going to have a strong bonding to that tooth structure. And maybe I can go slightly less, uh, let's say 0.8 millimeters. I would feel okay if I have proper possibility to do rubber dam isolation, control perfectly the humidity, and stay with one adhesive resin cement system. But if I have, let's say, a crown, and there's an area of that crown that it's more, let's say, subgingival, or I have an old amalgam uh, core buildup in that area, and then the bonding to that structure is going to be compromised, then I will not rely on the reinforcement that the adhesive cementation will give you, like in the first example. So in those cases, I will always maintain the 1.0 millimeter. So in summary, do I go thinner than one in the posteriors? Yes, only if I have a perfect scenario for a strong adhesive cementation.
Okay. Next question is, we often get this, and some people are confused for material types, and we get a lot of questions on what's the difference between a lithium disilicate and a silicate ceramic.
Yeah. So Basically, all are silica-based ceramics, right? And then there's different formulations that make the material more particular. Okay, so lithium disilicate is a material that has a very high crystalline phase and less of a glassy matrix. So more crystalline phase makes the material very strong, but more crystalline phase makes the material also less translucent because it has more crystal, less glass. So now what we are seeing are different generations of silica-based ceramics, like zirconia reinforced silicate ceramics. What are these? These are still silica-based ceramics, but that have small particles of zirconia, okay, that with this, the entire amount of crystalline phase is not as high, so you can get a better translucent outcome as well. So lithium disilicate, I will tell you, it's very safe. It's proven, but I will tell you, it's very gray as well because of the formulation. So these newer formulations try to maintain that strength while maintaining the best of the feldspathic ceramics that we love for the anterior zone. So this is pretty much a very basic explanation, but it is important. When I hear one material for all indications, I'm not on that train. Why? Because I want to make sure I can customize the treatment for all my patients, and depending on their needs, go to a material that will be more suitable for matching those specific conditions, whether are the aesthetic properties, the principal concern, or the functionability, the strength, and these other type of needs.
All right, and then another question is, what's your criteria of a milled restoration versus a press restoration? Do you have some kind of a triage where you think, well, this one would be better than that, or
Yeah. So when I'm doing single unit restorations, vital teeth in the posteriors, I would try to go for a same day mill restorations. I mean, I have the technology, I have the knowledge, right? We have the blocks, different options. And when we bond sooner, there's less risk of post-op sensitivity. That is something important. So vital teeth, single units, if I can bond that crown or that overlay immediately without provisionalization, that makes sense a lot. When we have partial coverage in the posterior, sometimes they are tricky to provisionalize, and then we use Fermit or any other temporary material, and they sometimes fall off or they get the tissue slightly inflamed around it. That's great for same day. Now, if I'm working on a patient that has, let's say, a difficulty to open and to stay cooperative, right? And maybe it's not my best prep, and if that happens to me, and if it's not my best prep and I see the scan, then you know what? I need the help here from the lab. I need the help from the pressable techniques that we have, because we know that there's no over milling in pressing, right? So when I'm concerned about the marginal adaptation based off maybe my prep was a little bit with an undercut here and there, or I had maybe some very sharp areas, then that's where pressing makes a lot of sense for me. And then I would talk to the technician, and the technician also has the possibility to suggest. And when you have a lab, you know that you're very efficient with the costs when you do pressing compared to mill ceramics. So also that's something from the laboratory side that would make sense. And Jim, if you don't mind, I don't want to know the number in dollars, the difference, but the relation. I think that a pressable restoration might be one third the cost of a mill restoration, or pretty much in that range. So pressing for the laboratory still makes a lot of sense.
okay? Yeah, no, it is. It's more on that labor side on the press versus the equipment side, I guess, on the CAD cam. Those
Yeah,
economics and
Sure.
And like you
But
said, if you've got the equipment, you've already put that investment in it. So yeah, and then the material, of course, itself is a little different in
yeah,
cost.
and the nice thing is that now we can print our designs, and then this is also makes the workflow, the print press workflow, much more efficient, as we did the traditional pressing everything by hand that needs a lot of ability by the person doing the wax up. Now we can do all that digital but still press and combine the benefits of both worlds, I would say.
All right. And then not to make this a commercial, but I do want to show you uh, this here real quick. Um, we just added on. I'll have to get you some, Julian, some MOs, some medium opacity Ambria,
Perfect.
with for that Lumex AC. So if you do have a discolor prep, this would be a material that you could mask out on the prep with this MO, and then do some overlay of porcelain on it. So that's
Perfect.
the M, and then
And
we have ST as well, super translucent. So
okay, yeah, I think the MO is extremely useful on combination cases on the anterior zone. Maybe you have a, a a crown in between a few veneers, right? So the crown might be thicker, and having that medium opacity would be great without making your veneers look a little bit dull, a little bit opaque. So I haven't tried the super translucent one, to be honest, yet. But I think that the idea is to get pretty much kind of to the feldspathic ceramic level of translucency. So excited to try those and give my honest feedback as well, as we've done.
yeah, no, of course, we're always looking for honest feedback. So
Right.
uh, a lot of questions were on your night guard. Do you always use a night guard on your ceramic cases, and how long do you use it? Soft or hard night guard?
Yeah. So patients are they understand all the effort that it took, both economically and from their time to get these nice restorations, right, and the effort as clinicians and our staff puts to getting this done. And when they are awake, they are aware of that. But then when they go to sleep, right, if they are grinding, if they are bruxing, they don't have that possibility to control and protect them. So whenever we reach to a moment that I would say, you know what, nowadays we can do ceramic restorations maintenance free, I would say it. But at this point, still in 2024, I believe that we need to protect the restorations, protect the tooth, because the patient got to this condition because some reasons, right? Just by making new veneers or new ceramics, we're not always controlling all those preconditions. So yeah, I always go through the importance of the night guard. And based on the material, we now use printed night guards.
Hmm?
But the key thing here is to get a night guard that is really comfortable for the patient. Okay, let's say I'm working today and I have a suit and I have some leather shoes that are very elegant, but they are hard shoes. I get home, you put some Crocs, you put some sandals, you feel more comfortable. That feeling, that's what you want your patient to feel when they put their night guard on, that in the morning they have rested masticatory muscles. So they need maybe 2 appointments for fine tuning the fit of the night guard. Um, I'm not a huge fan of the soft night guards. I'm more focused on making sure I have the time to adjust the night guard after the patient has used it for a few days. When the patient gives me that feedback, you know what, in the morning I feel some pressure on number 10 here. Okay, let me take the night guard. Let me remove a little bit more from the inside. Let's try it again. Let's reevaluate the bite with the night guard on. Those are the things that really make that a great help to protect our restorations.
All right. So just I don't know how you're doing on time. Just a couple more questions. Do you come across a good print wax for pressing?
Yeah, there are many, and I think this would be a better question for Telmo maybe. But we've been using DMG printing resins. Those ones are good. We have been using Vita's CAD wax blocks as well. So we use from multiple manufacturers, and that's why enjoy going to Chicago Midwinter or IDS, because you can really see what's out there. But to keep it honest, we don't know all of them, right? We might have one or two that we use. I suggest not to change a lot your materials, because if you change every month or so on, you never get to develop an expertise on the material, on the settings, on the calibration of the equipment. So that's pretty much what we try to do.
Yeah, good. All right. Last question is the Panavia LC. Is that also can be used for a titanium abutment?
Um,
The
Yeah,
Panavia
no,
is
it's not indicated for that.
okay.
For cementing to abutments, the Panavia V5 or the Panavia SA Universal that are dual cured would be the best option. Um,
Uh,
with none of them, we have changes on the color. So we'll address more on the cementation concepts on the following webinars as well, independent of what system you use. Okay.
okay. All right. Well, thank you, Julian, for doing the webinar. Excellent information as always. Appreciate it. Any last minute thoughts for the
No.
attendees?
Yeah, no, thank you very much, Jim, for the invitation. Congratulations on Vita North America on the 100 years, and thanks to the attendees for joining us today. And if you guys have any other questions, please feel free to contact me, and look forward to sharing more on the upcoming webinars. Thank you very much.
Thank you. And again, to everyone, the webinar will be posted on the VITA North America YouTube channel after a few days, and then we'll also get you your CE. So I want to thank everybody for joining us today, and especially thank Dr. Julian Conejo for putting together an excellent educational webinar for us. I appreciate it. So this will end today's webinar. Thank you for joining.